Hello and welcome. Today we're diving deep into a specific type of heart arrhythmia called sinus arrest. We'll explore what it is, what causes it, how it's diagnosed, and what can be done about it. Understanding sinus arrest is crucial for both healthcare professionals and anyone interested in heart health. So, what exactly causes sinus arrest? The primary culprit is a malfunction in the heart's natural pacemaker, the sinoatrial, or SI node. This node is responsible for initiating the electrical impulses that drive a normal heartbeat. Sinus arrest occurs when the SI node fails to fire, leading to a pause in electrical activity. Several factors can contribute to this malfunction. These include underlying heart conditions like coronary artery disease, sick sinus syndrome, or heart failure. Certain medications, particularly those that affect heart rhythm like beta blockers or calcium channel blockers, can also trigger sinus arrest. Electrolyte imbalances, such as high potassium levels and even problems with the vagus nerve, which influences heart rate, can play a role. In some cases, the cause may be unknown, termed idiopathic sinus arrest. To understand sinus arrest, let's look at the underlying processes. Normally, the SI node generates regular electrical impulses that spread through the atria, causing them to contract. This electrical signal then travels to the atrioventricular, or AV node, and down through the ventricles, causing them to contract. This coordinated sequence creates a normal, rhythmic heartbeat. In sinus arrest, the SA node stops firing for a period, causing a pause in the heart's electrical activity. If this pause is prolonged, the heart may miss one or more beats. If the pause is long enough, it can lead to a temporary decrease in blood flow to the brain and other organs. Escape beats, generated by lower regions of the heart, may kick in to try and compensate for the SA node's failure to initiate heartbeats. However, these escape rhythms may be slower and less reliable than the normal sinus rhythm. Sinus arrest can affect people of all ages, but it's more commonly seen in older adults, particularly those with underlying heart conditions. It's difficult to pinpoint the exact prevalence of sinus arrest in the general population, as many individuals may experience brief episodes without even realizing it. However, it's known to be relatively common among people with sick sinus syndrome or those taking certain medications that affect heart rate. Individuals with a history of heart disease, high blood pressure, or diabetes may also be at a higher risk. The symptoms of sinus arrest can vary widely depending on the frequency and duration of the pauses. Some individuals may not experience any symptoms at all, especially if the pauses are brief and infrequent. However, more prolonged or frequent episodes can lead to a range of symptoms, including lightheadedness or dizziness, fainting or near-fainting spells, also known as syncope or presyncope. Palpitations, or the sensation of a skipped or irregular heartbeat, can also occur. Some people may experience fatigue, shortness of breath, chest pain, or even confusion if blood flow to the brain is significantly reduced during the pauses. Diagnosing sinus arrest usually involves a combination of methods. First, a thorough medical history and physical examination are crucial. The doctor will ask about your symptoms, medications, and any underlying medical conditions. An electrocardiogram, or ECG, is the primary diagnostic tool. An ECG records the electrical activity of the heart and can reveal pauses in the sinus rhythm characteristic of sinus arrest. However, since sinus arrest can be intermittent, a standard ECG may not always capture it. In these cases, a Holter monitor, which is a portable ECG that records heart activity over 24 to 48 hours, or even longer, may be used. Event recorders, which are triggered by the patient when they experience symptoms, can also be helpful. In some cases, an electrophysiology study, or EPS, may be performed. This invasive procedure involves inserting catheters into the heart to directly measure electrical activity and identify any abnormalities in the SA node function. While sinus arrest itself doesn't have distinct types, in the same way some other heart conditions do, it's important to classify it based on its frequency, duration, and the presence of associated conditions. We consider how long the pauses last and how often they occur. Are they isolated incidents, or are they happening frequently? Are they related to any specific triggers, such as medication or exercise? Is it a component of sick sinus syndrome or another underlying heart condition? Understanding these nuances helps guide treatment decisions. The treatment for sinus arrest depends on the severity of the symptoms and the underlying cause. If the sinus arrest is infrequent and not causing significant symptoms, no treatment may be necessary. However, if the pauses are prolonged or causing bothersome symptoms, treatment is warranted. If a medication is identified as the cause, discontinuing or adjusting the dose may be sufficient. For more severe cases, a pacemaker may be recommended. A pacemaker is a small device implanted under the skin that monitors the heart's rhythm and delivers electrical impulses to stimulate the heart when it pauses. In addition to addressing the sinus arrest directly, It's important to manage any underlying heart conditions or electrolyte imbalances that may be contributing to the problem. While it's not always possible to prevent sinus arrest, there are steps you can take to reduce your risk. Managing underlying heart conditions, such as high blood pressure, coronary artery disease, and heart failure, is crucial. If you're taking medications that can affect heart rhythm, work closely with your doctor to monitor your heart rate and adjust dosages as needed. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also contribute to overall heart health. Regular check-ups with your doctor are important to monitor your heart health and detect any potential problems early on. The prognosis for sinus arrest varies depending on the underlying cause and the severity of the symptoms. In many cases, with appropriate treatment, such as pacemaker implantation, individuals with sinus arrest can live normal, active lives. However, if left untreated, prolonged or frequent episodes of sinus arrest can lead to complications, such as fainting, injuries from falls, and even an increased risk of stroke. Recent research has focused on improving pacemaker technology and developing more precise methods for diagnosing and managing sinus arrest. Scientists are also exploring new drug therapies that can help regulate heart rhythm and prevent pauses in electrical activity. Advances in understanding the genetic and molecular mechanisms underlying sinus arrest may lead to even more targeted and effective treatments in the future.